presenting a case of patient diagnosed with left-sided eagle syndrome who underwent left-sided styloidectomy. Patient having complaint of persistent left-sided throat pain, foreign body sensation in the throat, pain radiating to the left ear and neck that aggravated on swallowing and head movement. These symptoms are suggestive of classical eagle syndrome, and CT scan 3D reconstruction was done. As you see, the size of the styloid process on the left side is about 4.5 centimeter, while on the right side it's about 2 centimeter. So this case present with classical symptom of eagle syndrome. On oral examination, tenderness was elicited on the left tonsillar fossa, and on palpation, elongated styloid process was noted intraorally in the left tonsillar fossa. Trial of medical therapy has given about 6 months, but symptom still persist after medication. So patient required permanent cure of this. Considering the severity of the symptom, surgical management was planned. That plan was done transtonsillar styloidectomy with glossopharyngeal neurectomy. Patient taken under general anesthesia, tonsil was removed. Dissection carried out to identify the styloid process on palpation on the tonsillar fossa. Careful separation of the surrounding structure was done and the styloid process was removed after proper dissection of the styloid process and hemostasis was achieved. After removing the styloid process, I have done the glossopharyngeal neurectomy, and this nerve is lies just 1 centimeter anterolateral to the posterior pillar, and you just separate the muscle and you find the glossopharyngeal nerve, and you can dissect it out and you can apply coagulation over this nerve. After doing so, this nerve is neglected nerve, so there is no side effect. After removing the tonsil, I have done the suturing of the anterior and posterior pillar to decrease the bleeding and postoperative healing will be better. Advantage of glossopharyngeal neurectomy and styloidectomy, it increased result from 70 to 90%. And there are three approaches of tonsillectomy. One is transtonsillar approach, in which tonsil is present and styloid process is medially palpated. While there is already tonsillectomy was done, then there is transpillar approach, antipillar approach. And third one is when this styloid process is laterally rotated. In that case, you require Wilson's external cervical approach.